What if I told you, the reason your hair is thinning, your skin looks tired, and nothing you try seems to work? Isn't aging. It's not genetics. And it's not because you're doing something wrong. It's because your cells are literally running out of energy. And the most shocking part? There's a form of light, yes, light, that research suggests can wake those cells back up. But here's the part most people never hear. If you use it the wrong way, it can do absolutely nothing. Red light therapy is everywhere right now. Celebrities swear by it. Clinics charge hundreds per session. Devices are flooding social media. But most people try it. Get no results. And quietly assume it's just another wellness scam. That assumption is exactly why this video matters. Because red light therapy doesn't fail because it doesn't work. It fails because almost everyone misunderstands what it actually does. And later, I'll explain the one mistake that causes people to waste months, sometimes years, using it wrong. Doctors rarely explain this clearly. And the most important detail? It has nothing to do with the light itself. Let's start with something uncomfortable, but honest. Most hair and skin problems don't begin on the surface. They begin inside exhausted cells. Your hair follicles and skin cells are some of the most energy-hungry cells in your body. They divide rapidly. They repair constantly. They respond to stress faster than almost anything else. So when your body is under pressure, chronic stress, poor sleep, inflammation, nutrient deficiencies, hormonal shifts, your body makes a survival decision. It says, hair growth is optional. Glowing skin can wait. Energy gets redirected to organs that keep you alive. This is why hair thinning often starts during stressful life periods. Skin suddenly looks dull after illness or burnout. Expensive creams stop working over time. It's not that the product stopped working. It's that your cells no longer have the energy to respond. And this is where red light therapy enters the conversation. But here's what most people don't realize. Red light therapy is not about beauty. It's about cellular energy production. Inside almost every cell in your body, there are tiny structures called mitochondria. Think of them as microscopic power plants. Their job is to convert oxygen and nutrients into usable energy, called ATP. Now here's the key insight. As we age, experience stress, or deal with inflammation, those mitochondria slow down. When they slow down, hair follicles shrink. Skin repairs slower. Collagen production drops. Healing time increases. Research suggests that specific wavelengths of red and near-infrared light can interact with mitochondria and help them produce energy more efficiently. Not by forcing growth. Not by changing your DNA. But by improving how well your cells do what they already know how to do. This is why red light therapy is sometimes described as a support signal, not a stimulant. And that distinction changes everything. Let's talk about the uncomfortable truth. Most people try red light therapy for one of three reasons. Hair loss panic. Skin aging fear. Desperation after everything else failed. They buy a device. They use it randomly. They expect visible changes in 2 weeks. When nothing dramatic happens, they quit. Here's why that fails. Mistake number 1, treating it like a product, not a process. Red light therapy doesn't force results. It creates conditions for recovery. If your cells are severely depleted, inflamed, or nutrient deficient, light alone can't override that. It's like turning on a lamp in a room with no furniture. The light works, but there's nothing to illuminate. Mistake number 2, expecting surface-level changes first. Most improvements happen under the surface before you ever see them. Blood flow improves before hair thickens. Collagen signaling improves before wrinkles soften. Inflammation reduces before skin tone evens out. People stop right before the payoff phase. And the biggest mistake? Mistake number 3, ignoring timing and consistency. Cells respond to rhythm. Random use sends no clear signal. Short-term use rarely reaches a threshold. This doesn't mean use more. It means use smarter, which we'll get to. But here's something almost no one talks about. Red light therapy can make things look worse before they look better. Some people notice temporary shedding, mild redness, skin purging, sensitivity, and they panic. But in many cases, this isn't damage. It's cellular turnover speeding up. When sluggish cells wake up, old hairs shed to make room for stronger ones. Skin pushes out damaged cells faster. Circulation increases temporarily. This phase is not guaranteed. And it doesn't happen to everyone. But when it does, quitting too early cancels the long-term benefits. This is why awareness matters more than hype. Let's be very clear. Red light therapy is not a miracle cure for baldness. But research suggests it may improve blood flow to follicles, support follicle energy production, extend the growth phase of hair, reduce inflammation around follicles. What it cannot do: revive completely dead follicles, override advanced genetic loss, replace medical treatments when needed. This is where most people get misled. If hair loss is purely genetic and advanced, red light therapy may offer support, not reversal. But if hair loss is related to stress, hormonal shifts, nutrient depletion, post-illness shedding, inflammation, then the potential is very different. If this sounds like you, if your hair loss started suddenly, or worsened during a stressful period, that distinction matters. Most people think red light therapy is about wrinkles. That's only a small part of the story. Research suggests red light exposure may support collagen signaling, improve skin barrier recovery, reduce inflammation, improve circulation, help with texture and tone. But here's the overlooked benefit: skin resilience. Not looking younger, looking healthier. People notice faster healing, less sensitivity, better response to skincare, more stable skin tone. This is why many dermatologists describe it as a supportive therapy, not a cosmetic fix. And that framing changes expectations, in a good way. But now we need to talk about something uncomfortable. Why expensive devices don't automatically work better. This surprises people. More expensive doesn't always mean more effective. Why? Because results depend on wavelength accuracy, distance from skin, consistency, duration, overall lifestyle context. Not branding. Some people spend thousands and see nothing. Others use modest setups and see gradual improvements. This doesn't mean cheap is better. It means understanding matters more than spending. And no, more intensity is not always better. Cells can only absorb so much signal at once. Instead of asking, will this fix my hair or skin? Ask, am I creating conditions where healing is possible? Red light therapy works best when paired with adequate sleep, nutrient-dense food, stress regulation, gentle skincare habits, patience. This isn't limitation. It's realism. And realism builds trust. This is not a diagnosis, just awareness. People who should seek professional guidance first include those with light sensitivity conditions, certain skin disorders, active cancers and treatment areas, people on photosensitizing medications. Red light therapy is generally considered low risk. But low risk is not the same as risk-free. And anyone claiming otherwise is overselling. Now here's the part almost no influencer mentions. Why red light therapy sometimes works best when you're not focused on looks. When people obsess over appearance, stress increases. Stress increases cortisol. Cortisol reduces skin repair. Cortisol disrupts hair cycles. Ironically, the more desperate someone feels, the less responsive their body becomes. People who see the best results often treat red light therapy as a calming ritual, a consistency habit, a recovery practice, not a last-ditch fix. That mental shift alone can change outcomes. Here's what many experts suggest. Weeks 1 to 4. Subtle changes. Improved skin feel. Less irritation. No dramatic visuals. Weeks 5 to 8. Improved tone. Reduced shedding. Skin responds better to products. Months 3 plus. Visible texture changes. Stronger hair appearance. Gradual density improvements, if applicable. Anything promising overnight transformation is lying. Red light therapy doesn't replace anything. It amplifies what you're already doing right. If you sleep poorly, eat nutrient-poor foods, live in chronic stress, overtreat your skin, light won't override that. But if you're supporting your body, it can become a powerful ally. So here's the real truth about red light therapy. It's not magic. It's not fake. And it's definitely not instant. It's a conversation with your cells. A signal that says, you're safe enough to repair. You're allowed to grow again. You can invest energy here. Hair and skin are not vanity signals. They're health signals. When they struggle, something deeper is asking for support. And whether you ever use red light therapy or not, understanding that connection changes how you care for yourself long-term. If this helped you see your body with more clarity, stay curious about your health. Because awareness is where real change begins.